Okay, everybody, it's that time of year again. And for some of you watching this video, you're wondering, is my child going to need an ADHD medication? Is this the year that my child will go on an ADHD medication? And the second and maybe more important question is, what's that going to be like if it happens? All this and more on today's live stream. Welcome. Hello, everyone, and welcome. I am Dr. Nate Noble, developmental behavioral pediatrician, clinical geneticist, and this is a live stream to answer the most common questions that we're getting both in the clinic and this time of year so that you can get what you need all in one spot and nothing that you don't. The question that I'm getting over and over and over this time of year is, is my child to the spot where an ADHD medication should be considered? Now, I've got other videos on that. I'll link them above for your viewing pleasure. But today I want to talk about, if you start a medicine, what is it that you can realistically expect to happen in your child? And that is how I want to start this. But it's very important as we begin that you understand that starting a medication for your child, right? If your child demonstrates a level of impairment in school or in the community, and you feel like a medication is necessary, starting a medication is not failure. Okay, it's not failure. It's not bad. It's not wrong. It's not terrible. These are safe and effective medications when used in the right clinical context. And please don't beat yourself up about it. All right. But if you're going to start a medicine, let's talk a little bit about how they work but more importantly, what you can expect. Let me tell you why I'm giving you this little lecture. This is me. This is me circa 2012. And you can't see the bottom half. You can't see the bottom half of my body in this photo because honestly, because it was, hidden by a pile of Ritalin. I mean, I'm joking, but I was on all these medications that we're going to talk about today, all the side effects, all the ways that they impact you. I know this because A, I've prescribed these medications for kids over the last 20 years, and B, I've been on them. This was me, as I've said, circa 2012, maybe 30 pounds lighter than I am now. And again, one of the things we're going to talk about in terms of side effects is weight loss and appetite suppression. And certainly I have experienced that. I mean, I look like a skeleton man who woke up in an Abercrombie and Fitch and had to cover himself with clothes and run out of the mall. Not a great look for me. Okay. But again, if the medicine works and it's effective, then you do you. But that's why you're getting this information from me. Here's a little overview of what we're talking about today. Because if you're not sure this video is for you, here's the outline. Okay. People aren't giving you outlines on YouTube. Here's the outline. Okay. Here's the things on the left that ADHD medications will do for you. And these are obvious, but I'm going to give you some background. So just stick with me. We're going to talk about focus. We're going to talk about impulsivity. We're going to talk about hyperactivity. Okay. Those are the goods. All right. That's why you take the medicines, right? It's in the name, ADHD. But then there's some downsides, right? Because again, what can your child reasonably expect to experience with starting a medicine? The downsides, as we're going to talk about, appetite, withdrawal, and then the evenings. We're going to talk about the evenings, okay? Because these are fairly predictable side effects that I think everyone considering these types of strategies for their children deserves to know. Let's start with focus. Now, listen, as I've said, these medications, they work. They work dramatically. They work. I was initially placed on an ADHD medication when I was in fellowship. Okay, so I'd somehow got through medical school, and I want to say barely. Okay, I did okay, but I had to work really, really hard, and I finally got to the spot where I graduated to my level of incompetence. I mean, that's a quote from a leadership book from the 70s, but I think it fits well here. All of us with ADHD, if you have a child with ADHD, doesn't mean your child's not intelligent. Okay, it doesn't mean they're not intelligent. Doesn't mean they don't know a bunch of stuff and they have a bunch of skills and abilities. Essentially, what it means is that they have to oftentimes work twice as hard to keep up with the rest. And I was no different. I got put on an ADHD medication in fellowship after going through a psychological evaluation because my program at the time thought maybe I had some learning difficulties, which they weren't wrong. Okay. I got put on an ADHD medicine, and it was literally like someone turned the lights on in a dim room. I was like, what? This is what it's like to not fall asleep in the middle of a standardized test. Now, and that was just my experience. Okay. And you might be watching this and being like, boo, doctors just want to put pills in kids' mouths and drive around in white vans. No, we don't, by the way. No, we don't. Okay. But in the right context, for the right kid, when you start the right medication, focus dramatically improves. So much so that that intervention, coupled with some test taking strategies that proved incredibly useful, allowed me to pass my boards, 3 sets of boards, and do well. And not that that's going to be everybody's story, but I think everybody could have a degree of success that's far beyond what they're currently navigating if they have a clinically impairing form of ADHD. So yes, the focus of your child, right, will improve dramatically within the first 30 to 60 minutes. Now, it's not perfect. Okay. We're going to talk about later what other things go wrong and what are the side effects and problems. But know that if you're going to use a medicine to manipulate the neurochemistry of a child's brain because they have a discernible impairment that leads to a dumpster fire life, then using a medication that's safe and effective is not bad or wrong. It is not bad and it's not wrong, but you better make sure that you dose it and you pick a strategy that's going to be effective, and it should be dramatically effective, just like it was for me. And that's what I see in kids that I treat. So do these medicines dramatically help focus 100%? What's the next thing? What's the next thing you could expect your child to experience on an ADHD medicine? Well, let's talk about impulsivity, shall we? Now, some of you have ADHD as adults, and you're watching this and you're thinking, I've got ADHD, but I can control it. Well, when you think about impulsivity, okay, when you think about impulsivity in a kid, kids are all rocket and no rudder, right? They got all this energy and power, but they got all this thrust, but they got no way to steer it. So kids are making poor choices. Kids are impulsive. They're getting out of their chair. They're jumping on stuff. They're putting their hand in the iguana tank and then they're licking it, which is also a bad idea. You should wash that first. But they're making these poor choices, right? And it's like, I think it, and then I do it. I just think it and I do it, right? That is impulsivity in kids. Now you're thinking, well, I'm an adult and I have ADHD, and you're not going into a boardroom as an adult with ADHD, and you're not so impulsive that you're giving your boss a wet willy in the middle of a meeting. You're not like, well, I'm gonna woohoo. You're not doing that. You're not doing that. But there may be other things you're doing that are impulsive, right? Impulsivity in kids is easy to spot. They're in trouble. They're in trouble all the time. They're in trouble as a general rule. They're coming up with poor choices, and they're coming up with poor ideas, and they're just doing it. Adults can get impulsive in other ways, right? Think about the times that you binge, you scroll through Facebook, or you get into an Instagram thing that just takes you to the depths of the ocean of waste of time, right? Think about that new hobby that you're going to start at 4 a.m. where you're going to buy something off QVC and learn how to play the mandolin. Like, just think about that. Just think about that kind of stuff, right? You're still impulsive, but it's in a very different way. And in children, when they're treated with an ADHD medication, you would expect that level of impulsivity to dramatically improve. So the metric that you're measuring against is, are they in trouble? And if so, has it decreased from what it was prior? Because impulsivity in children tends to get them in a lot of trouble. All right. Next up, hyperactivity. Now, this is also a pretty easy one to spot in kids, right? It goes along with impulsivity. They're out of their seat. They're running around the room. They do different things, right? They run on a motor. They go, go, go. They can't stop. They can't sit. They can't listen. They can't do anything, right? Now, and again, that is in children, you would expect their level of hyperactivity to increase to some extent. But we have to take a moment here to take a quick break, because you need to understand that these medications, ADHD medications, stimulant medications, so Ritalin, Adderall, Vyvanse, Quilivant, Quilichu, whatever, all these things are really, really good, but they don't serve to sedate your child, okay? They don't serve to push them under so far that they become say it with me, a zombie, okay? Listen, they're not zombies, okay? Now, do some children respond in a kind of respond poorly to ADHD medicines because maybe they're just too sensitive or the dose is too high, and they get a little withdrawn? Withdrawal is what I like to call it, okay? Because when I think about a zombie, I mean, I think about, like a sedation. I'm just pushing someone under. But withdrawal is what we're talking about here. Withdrawal is I get so hyper-focused, like I'm squeezing my neurons a little bit too hard that I'm just really deep on this puzzle or this book or this YouTube video or spiders. Do you know what I mean? So I don't want you to think that we're sedating them. We're drawing them into whatever is in front of them so that they don't really diversify their interest much. So their hyperactivity and their impulsivity go down. And sometimes what happens is that families come and they say, look, I just feel like there's just too much withdrawal. And I agree with that. If there's any reason why I stop these medications, and there's several, but one of the number one reasons that I stop an ADHD medicine as a child is because I don't want withdrawal. I don't want to see it. I don't want to squash their joie de vivre, right? Their zest for life. I don't want that. I want lateral movements and vertical movements. I want them to be fun. But sometimes when you're going aggressively at hyperactive and impulsive features, when you're trying to increase their ability to focus and attend to task, sometimes you have to rob Peter to pay Paul. And so those things are going to go down. They're going to get in less trouble. They're going to be better equipped to be successful at school. But sometimes it's a balance between, maybe they're too withdrawn and we have to stop. But in summary, when you think about how these medicines work, they help with focus, they help with impulsivity, and they help with hyperactivity. And it is no joke. Like, I don't get a lot of handwritten letters in the field of developmental behavioral pediatrics and clinical genetics. I don't get a lot of handwritten letters on papyrus from people thanking me, except for when we treat kids with ADHD, because they come to us and they're not successful in a whole lot of environments. I mean, they're in trouble everywhere. Their grandparents don't like them. The teachers don't like them. The soccer coach doesn't like them. The violin coach doesn't like them. Nobody, this kid struggles to even like themselves. And it takes one to know one. I'm not being critical. I'm trying to be sensitive. But sometimes when you put stuff on the internet about ADHD, people don't waste any time putting in the comments how terrible of a doctor I am because I treat impairment in children whose lives are dramatically improved by an evidence-based best practice medication that will improve the quality of their life and those around them. But somehow that makes me a terrible guy. Okay. But please know that these medicines work and they work well. Okay. But there are some side effects. All right. If you have any questions during this live stream, feel free to put them in the chat. I'll see them and we'll talk about it. And that's the benefit of doing a live stream, is I'm here to answer your questions, or put them in the comments on the upload and I'll see them there and we'll do our best to get back to you. Okay. Now let's talk about the other side of the coin. All right. Now listen, here's what we're going to talk about. There's some downsides. Okay. And let me give a disclaimer. Medicines that have effects often have side effects. Show me, okay, now there's examples that I'm not going to think of, but in general, show me an example of a medication that has tremendous benefit and no drawbacks. I'm sure they're out there, but in pediatrics, in the work that I do as a developmental pediatrician, I don't have a lot of those at my disposal. Medicines that have effects have side effects. Is the juice worth the squeeze? Because you're going to get some juice, but is it going to be worth it? First and foremost, we got to talk about appetite. If anybody has a question for me about it, if anyone has a question or a concern in the clinic, it's always this one. Okay. It always is this one, because they'll always say the same thing. What are you going to say to me? You're awesome. You're a great parent. I love talking with you virtually through the internet. You're a great parent. What are you going to say to me? You're going to say two things. You're going to say, well, Noble, he already doesn't eat anything but air and popcorn and licorice. I don't know. You're going to say that. And then the second thing you're going to say is, I can see his ribs. I get it. I can see his ribs too. He probably does have a fairly selective diet. I'm not trying to minimize your concerns. I'm not trying to do it. Okay. But please understand that, the appetite is a concern for a lot of people. And essentially what happens is when you manipulate the neurochemistry of a child's brain with ADHD medications, you're going to increase the productivity of dopamine and norepinephrine. Okay. And those are fight, flight, and pleasure hormones. Okay. So you're riding a roller coaster. You're not wanting to eat a hamburger. You're getting chased by a guy trying to steal your wallet. You're probably not going to want to take a nap. Okay. So when you increase the presence of those neurotransmitters in the synaptic cleft to do their job on the work floor of executive function, you're going to have some side effects. You're going to have some trouble. And first and foremost, you're going to have appetite problems. But listen, there's ways to deal with it. You can supplement their caloric intake, bookend it. So in the morning before they take the medicine, give them a protein-based smoothie under the guidance of your primary care provider. At the end of the day, in the evening after they've had dinner and they've had a second dinner, give them another protein-based, calorically dense smoothie with avocados and whole whipping cream and bananas and chocolate chips, whatever you want, right? I mean, yes, you have to watch it. And yes, you have to take some guidance from your primary providers. But in general, you can make up a ton of caloric deficit if a child will drink. How do I know? Because so many people in our culture are struggling to lose weight, and it's hard. And I'm trying to be sensitive. But usually the best place to start besides exercise is to get rid of sweetened drinks. You know it, and I know it. All right. So drink, drink, drink. If a child will drink, they can gain weight, or they can at least maintain their weight. What's next? Withdrawal. I already talked a little bit about this. I don't want to see anybody withdraw. Okay. I don't want anybody. And what withdrawal doesn't mean what you think. It doesn't mean like you skip a dose and you curl up in a ball and sweat a bunch. That's not what I mean. What I mean is like you withdraw, like you go inside yourself and you're not fun and you're not interesting. You're not smart. You're smart, but you're not as lively, right? And people see it from a distance, and these kids will come in and they'll come to the clinic, and I'll ask the parents, I'll say, is this how he is? Is this how this guy normally is? And he'll just be kind of quiet, kind of zoned in on what we're talking about, right? And if I see that, we're either decreasing the dose or getting rid of the medicine, because listen, the juice is not worth the squeeze on that particular issue. All right. And so withdrawal, we got to watch it. And then lastly, let's talk about this, evenings. Okay. Now listen, biggest misconception of ADHD medications. No, well, two of them. Okay. Hold on. We got a comment. I love you, Dad. Thanks. Noble Detailing. Best detailing in the world. Get your car detailed by Noble Detailing. That was nice. Thanks, man. That was nice of you to chime in. So back to what we're saying. Listen, so I got off track. Evenings. Biggest misconception about ADHD is twofold. Okay. Here it comes. The first of which is ADHD medications make children make better choices. Nope. No, they don't. All that ADHD medications do is give your child enough focus and attention to decide, after they've weighed the benefits and the drawbacks, of making whatever decision they were going to make anyways. Okay. Now I get it. That's a little counterintuitive to what I've said so far, but if you think about it, it's got to be true. These aren't decision-making medicines. They're a 7-second radio delay. Okay. There used to be an old announcer on Hawkeye football named Ed Podolak, who's not on there anymore, and I miss him. I don't know if he's passed away. I don't know. Let me know in the chat. But anyways, they had to have a 7-second radio delay sometimes because, you never know what these guys are going to say on live radio. And I loved them for it. Right. But at the end of the day, that's what these medications do. They have a 7-second radio delay. They give you a chance to think about, should I really jump out the window? Is this really the right decision for me? Yes or no, right? So the first misconception is that these are somehow behavior medicines, right? They make you make better choices. They don't. The second misconception is that they function to do anything but treat the school day. All right. Now, or the 8 to 5 day, we'll say. Now, if what happens is families will start a medicine and they'll say, school's going great. School's going great. IEP interventions are decreasing. School's singing their praise. He's doing so awesome. Everything's wonderful. But here's the thing, Dr. Noble, evenings are hard. And I go, yep. I just don't think we're getting enough support for the evenings. And I say, listen, friends, this is a juice versus squeeze situation. Again, I'm functioning in this clinic to help your child be successful in the areas of life that matter most, which in this context is their ability to attend a task and focus at school. Now, I don't mean to say that that's the only thing that matters, right? We don't want kids that are, their personal social relationships, their home are on fire. Of course not. Of course not. But what you have to understand is school is the objective, right? Focus and attention during the school day is what we're aiming for. So when your kid, if you have a child who has, lost their ability to focus and attend a task, and even gone further than they did before, they're even worse than they were now. You're like, I saw Noble and that rascal put him on a medicine, and man, he sure is doing good at school. But boy, oh boy, home is a disaster. That kid is off the chain. Yes, yes, and yes, because the medication is gone. The pharmacologic support is gone. The support of dopamine and norepinephrine is now dissipated, okay? And you get your child not only unsupported from a pharmacologic standpoint, but off the chain, right? So sometimes it can look like they're even worse than they were before. And the evening hours from 4 to 9 p.m. can be an abject dumpster fire, right? And not only are they more hyperactive and impulsive than they would have otherwise been, but sometimes they struggle to go to sleep because they're very sensitive to the medicines. And as I've said earlier, these medications, they focus your brain. They don't bring peace. They bring the sword. They bring the sword. right? And sometimes the sword is what's needed, but sometimes there's too much sword. The kid's too sensitive and they can't initiate sleep, and that leads to a whole nother set of problems that I don't want for your child. So that's our big presentation for today, but I have more to tell you. Here's the notice me slide as we get ready to close our time together. Listen to me. Don't get mad at me. These medicines work. Hey, yes, they do. Yes, they do. I can speak personally about how much they work, and I can tell you we wouldn't use them if they did not work. But here's another thing I want you to know. These medications are safe. Now, you're hearing me say, wait a second. He just talked about a bunch of side effects, and yes, there's abuse potential in people, and yes, there's a street value to these medications, and they can speed up the heart rate or they can increase the blood pressure. Okay, yes. But remember what I said. Medicines that have effects have side effects. But we know about these side effects. We can manage them and plan for them accordingly, and we can successfully navigate them so that your child gets all of the benefit and as little of the drawback as possible. All within 20 to 30 minutes of taking the medication. Okay, so you can see it's a pretty good proposition when it's medically warranted to consider. And then lastly, I want to invite you, if you're new to the channel and you want to jump in when I do these live streams, which is, who knows, I do them whenever I can, whenever the questions pop up enough, I want you to like and subscribe. Like and subscribe. Don't forget to put your questions in the chat. And thank you so much for joining us today. That's our presentation. This is a joy. We'll see you in the next video.